Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Altman Health Systems. Today, pharmacist Brad White and I am broadcasting from our administrative offices, and our very special guest is Amanda Archer, the Canton City Health Commissioner. Good morning and welcome to the show.
Hi, good morning. Thanks for having me.
Amanda Archer, MPH, was appointed Canton City Health Commissioner on January 25th, 2024, and is the first woman to lead the department since inception in 1849. Amanda is a 1998 graduate of McKinley High School and began her tenure with the Canton City Health Department in 2014 as an epidemiologist after earning her Master of Public Health from the University of Akron. She became Director of the Office of Public Information and Innovation in 2020. We'd like to remind our listeners today our program's also available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
Okay, good morning, Amanda. Tell us a little bit about yourself.
Hi, good morning, Paul. Yeah, so my name is Amanda Archer. Like you said, I was a 1998 graduate of McKinley High School, so born and raised here in Canton. Proud graduate of McKinley High School. My family's still here. I spent a lot of my time here. And right now, things are very busy, focused on the new role as Health Commissioner of Canton City Public Health. But if I'm not working, I typically am spending time with my family and friends, or trying to travel somewhere, or trying to snag tickets to a concert somewhere. And then in my spare time, which I tried to do right before I was appointed and kind of paused right now, but I actually foster English bulldogs, French bulldogs for fun until they can find their forever home. So that's kind of a little background on myself.
Interesting. So,
yeah.
Congratulations on being the First Lady appointed to the Health Commissioner position.
Thank you.
Of Canton. Tell our listeners about the journey to the present position and what it means to you.
Wow, sure. Well, so when I actually, after graduating, finished with a degree in biology from Kent State University many moons ago, almost 20 years ago. And I actually secured a job with Stark County Coroner's Office, and I was able to work there for nearly 9 years under Dr. Murthy, Dr. P.S. Murthy, and learned a lot about, city or county administration. And I'm pretty sure I was hired because I had a background with the biology with some medical terminology and understood a little bit about, anatomy, physiology, and then also I could type really fast. So they hired me to type reports and work in the office, and I worked my way up through there. Ended up being one of their coordinators. And when I was there, I kind of identified, started seeing some trends with some of the deaths, unfortunately, that were coming through, associated mostly with overdose. And it kind of was the start of the opiate epidemic here locally, and it piqued my interest. And so I got interested in some of the data, and I was able to get involved in some of the other community task force and groups that were trying to address the problem, and spent a lot of time in that space representing the coroner's office, bringing data and trying to figure out if there was something that we could do as a community to address the problem, and really started to understand just the complexity of a lot of these social issues that we have. And about 5 years into that role, I kind of started thinking, what do I want to do? In the role that I was in there, I was kind of at the end of the problem. And I thought, is there something that I could do, or maybe I can be part of the solution before it gets, as bad as what it was or what it was becoming, and I remember then thinking, seeing how bad it got, and not realizing, I haven't been there for 10 years, and it just got worse, as we went. So at that time, I decided to go back to school, and I worked, under the great physicians there at the coroner's office who supported education, and I was able to secure my master in public health degree in 2014. And then shortly after that, I interviewed and was offered a position at Canton City Public Health as an infectious disease epidemiologist, and I was also able to continue the work I did with the opiate epidemic. And then after I was there about 5 years, I was promoted to a director role that was previously kind of vacant we were accredited nationally, and they needed somebody to oversee that work, and then also some other foundational public health programming like emergency preparedness, the epidemiology work. But the ironic part was I was promoted in January 2020, and then COVID hit in March 2020. And so I truly just slid back into my epidemiology role until we were able to dig our way out of that. So what does it mean to be the first female health commissioner? I don't think it's really hit me yet. I think it was always interesting to me that public health is predominantly female, but there are, other wonderful female health commissioners across the state who have kind of paved the way. But predominantly the leadership, the senior leadership, the health commissioner roles, the directors, those were the male. So I think it's exciting that we're getting to a point where we have the leadership, the female leadership. I used to always joke that, we had a all-female senior leadership team under Jim Adams, who was wonderful, but I used to always joke that that's where the work actually gets done because of the ladies. So I know I wouldn't be here without the leadership and the guidance of the team that I've worked with, and also, under Jim Adams. So I'm really excited for the opportunity to do the same for someone in the future. If, there isn't equal representation, and excited to start breaking those norms.
Wow.
Yeah.
How about telling us the history of the Canton Health Department? How long has it been in existence?
Well, good question. So actually this year, where are we at? 2024, we're celebrating our 175th anniversary.
Wow.
Yeah, so it's
Cool.
actually pretty remarkable. So the health department, public health work, and, reducing the spread of communicable disease goes back hundreds of years. And so in Canton, they actually stood up the first health department in 1849. And it was in response to anticipating a smallpox transmission epidemic. And so they put together, basically a health department to manage that. I have a couple dates here that are just kind of interesting. We're starting to kind of look back through the history, especially now that COVID's over, because obviously that's super historic, and kind of reflecting back about what that looked like and what we went through. But let's see here. So we've got some pretty neat dates that we have. Back in the 1800s, we did deal with cholera, polio. Obviously 1918, we had the great, influenza pandemic of 1918. But in 1870, Canton actually appointed the first health officer. And in 1872, the Board of Health set up their first, what they considered back in the day, these pest houses, which is where they put sick people to kind of keep them away from the general public. So, there was a lot of kind of polarization around isolation and quarantine during COVID, but this is actually a really long-standing public health best practice. At its core, if you are sick with an infectious disease, we would want to remove you from the general population until you're well, so that you don't spread it, to other people. 1893, the Board of Health required children to be vaccinated against smallpox. And then in 1936, we had a laboratory, and they considered it modernized in 1936. So, and then another one, which I just don't know if I'd ever seen this, if I hadn't seen it discussed and happening during COVID. But in 1947, because polio was so bad in some neighboring areas, they actually canceled a football game in Canton, Ohio. So I think that's a very remarkable milestone in our history. So that's just some of the history. We've been around a very long time. We've seen kind of the different modern medicine and modern public health interventions, immunizations, clean water, clean food that have really reduced some of the diseases and illnesses that used to be common day that we just don't see anymore.
Wow. Interesting.
Yeah. And then 2020 COVID global pandemic that your local health department went through. So
All right, well, let's talk about, you've kind of danced around it with some history, but what's the official purpose or mission statement of the Canton City Health Department?
Yeah, so I think people typically they only know what the health department does, but because when they need us, right? So they might only be familiar with walking into the health department to get a birth certificate, or making an appointment to get their kids, their yearly immunizations, or for school or something. So the health department is actually made up of about 9 different program areas or teams, and we manage many different programs. And the function really of the health department is to prevent the spread of disease. That's kind of like our primary role. We want to promote health and healthy behaviors across our community, and then protect the community from harm. And we aim to also do this, which I think is really important. We aim to do this in the least invasive way possible. And so what we want to do is create policies and implement programs that don't invade in people's lives necessarily, but that over time the public benefits. So that's kind of the focus that we have. And yeah, so we have nine departments in our agency, and we manage many different programs. So we have like our vital stats department, which is what people traditionally think of as like birth and death records. We have an air pollution control department. We have an environmental health department. We have our women, infants, and children department. We have obviously administration, and a group that we call Public Health Information and Innovation, which is where I was the director. We have our nursing team. We have a group called Thrive, which is a community collaborative for infant vitality. And then we have a laboratory. So we're actually one of the few health departments in the state that still has our own internal laboratory. So that's run by a group of lab professionals. And then, the other big thing was in 2019, which I think it's important to the community to know, that we were nationally accredited. So we're one of the health departments in the country that is an accredited health department, which basically means we're doing what is expected. We're doing what we say we're going to do. And all of that is measured and monitored to kind of keep us moving in the right direction. So when people think about the health department, I think that I always say, if you look at like your day to day, you might not know that the health department is impacting you, but from the minute that you wake up, and you have, clean water to make your coffee, which is really important to a lot of us. That is public health at its core. Same thing with the food that you're eating for breakfast. Brushing your teeth with clean fluoridated water, public health. Driving to work in cars with, access to seatbelts and airbags, is public health. Going to lunch and buying your lunch at an inspected restaurant that is up to snuff with their restaurant inspections, and being able to eat your lunch in a smoke-free restaurant. That's a public health initiative that was passed. And then even just walking and enjoying clean air, quality air in your neighborhood in the evening if you go out for a stroll. And then finally at night, putting your baby down in a sleep safe environment, and educating people on what that looks like. So kind of the span of the day, public health is kind of touching us all across our normal interactions, and maybe people don't think about that. Yeah.
Okay. I think it's time for our first break, is it not, Brad? Okay. You're listening to Health Matters with the Medicine Center Pharmacy.
Okay, welcome back to Health Matters. So, Amanda, can you talk about services that you offer for individuals and community groups?
Yeah, sure. So like I said, we have 9 program areas across the health department. And there's many programs there. And so I won't have time to kind of go into all of them. And I encourage people who are interested in learning more to follow our Facebook page. We do a really good job of really promoting the programs that we have. We're also just checking out our website at cantonhealth.org. They can go on there. We're actually reworking our website, so I'm really excited for that launch to come up here in the next couple months. But yeah, like I said, we have, if somebody wanted to come in, we offer birth and death records. So if somebody's looking for that, they can walk into our vital statistics. They can also get those, request them online. And we have birth records that go back to, I think, about 1909. If somebody's looking for something, for genealogy purposes or historical purposes, we do have that, and we offer that service. Our nursing team, you know, they're kind of known, I guess, for immunizations. And so we do have childhood immunization clinic, and we also have a travel clinic. So if somebody's going out of the country and they need, you know, very specific vaccines, we can help you identify those and offer many of them if you're traveling out of the country. Obviously, in that, you know, from a public health standpoint, that's so that you don't get sick, but it's also so you don't bring something back to the rest of us. And we have a sexual health clinic, and we also operate a comprehensive syringe access program. So those are some of the public-facing services that our nursing team provides. We also provide education on overdose prevention. We do naloxone distribution, and we have a robust program of community partners who participate in that program with us. And so we're able to get the naloxone and the education, you know, out to the community better than if we were kind of doing it solo. So the partnerships are really important in a lot of the work that we do. We have a WIC program that serves, I think, I want to say 2,000 people a month, which is pretty intense. That might be a high estimate, but I'm sure it feels like 2,000 to our staff. We're actually over our caseload, anticipated caseload for the year. Still serving people, you know, not turning people away or anything, but they've been very, very busy, and they're able to provide supplemental nutrition to clients and provide access to our registered dietitians to make sure that you know, our infants and children are getting what they need to grow up healthy and strong. We are our environmental health center, or I'm sorry, our environmental health department. We operate as a recycle center, which is actually open to the community on Schroyer Avenue, where you can go in and you can take pretty much everything except for latex paint. So I don't know if anybody knows what to do with latex paint, but
I do.
yeah, okay. But you can take tires, and it's really important. You know, this is a space where you can drop things off to kind of clean your yard up, so that we don't have environments that might be primed for pests and bugs to grow, which also can transmit disease. So, you know, it links back to that public health piece. The environmental health team, they respond to public health nuisance complaints in the community. And they also inspect all of our restaurants, and they inspect our tattoo parlors and our pools, you know, to make sure that, you know, we're not spreading disease, you know, through unlicensed or unchecked facilities. We have an air pollution control team that monitors our air quality. I don't know if you guys remember, I don't even know when it was now, like maybe 9 months ago. It's kind of a blur when there were some Canadian wildfires and our air quality was way off the charts. So our team there, they actually do all of Stark County. They monitor the quality of the air. And the importance of that is when we have something that might be a sensitive or a higher level, that it might be sensitive to groups who have different health conditions, we can provide education and guidance and kind of public health alerts, you know, about, you know, if you have a chronic disease, respiratory illness, or a heart condition, that maybe it's not a good time to be outside because it can be kind of hard on you, especially. And they also respond to complaints, and they do permitting for industry to maintain air standards in our community. And they ensure compliance with those permits. So they have a really robust program there as well. And then our Thrive Collaborative, which is to focus on infant vitality. You know, that's ensuring that all babies thrive in our community. We do have a disparity right now where our African-American community is carrying the burden of those infant deaths, and working to get that number down. And, you know, we really want our focus, the mission there is that, you know, that all babies thrive in our community. And it's a very large community collaborative working on that issue. And like I said, you know, when I was with the coroner's office and realizing very, very quickly that the overdose epidemic, you know, was a very complex problem, so is the infant vitality and the maternal and child health challenges that we have. It's not a, you know, one size fits all. It's a very complex issue. So working through that to try to see some sustainable change there. And, you know, some of the other programs that we have in-house that obviously we have our laboratory. So we're able to do water sampling for the community. And then it also supports some of our internal programming, especially with our nursing team. And then we have these like behind the scenes programs that the community might not know about, but they're very foundational to our health department. So that's our epidemiology program, emergency preparedness. It's our accreditation standards. And then we also have recently hired a community engagement specialist so that we can kind of get back out into the community. COVID kind of squashed a lot of that stuff. So really trying to get back out in the community, connect with our community members, find out what they need from us so that we can serve them better. So yeah, so that's kind of the nuts and bolts. I'm sure I feel like I forgot somebody. But yeah, nine teams, I guess, that deliver many programs across. And like I said, if somebody has a question, they can give us a call. Our Facebook, again, is a wonderful place to get information, just kind of by osmosis, just reading through things that come across your feed. And we have quite a large Facebook following. It's a very active page. So I encourage anybody to follow us there at Canton Health on Facebook.
I think given how much you've mentioned and how many, such a wide variety of things, can you list the phone number too, in case people want to reach out? Because I think that there's, with so many things you just mentioned, we'd be remiss if we didn't mention a contact phone number in addition to your Facebook page.
Yeah, sure. So, our phone number for our direct line is going to be 330-489-3231. And that's going to then take you to a menu, so you can kind of pick what team. But if you pick the wrong one, we'll get you to where you need to go. And then again, our Facebook page and our website also has information on it. But if anybody has a question, absolutely give us a call, and we'll do what we can to help or point you in the right direction.
Excellent. All right. Well, it is the bottom of the hour. It's time for the news. Thanks for tuning in to Health Matters with the Medicine Center Pharmacy. We'll be back after the news.
Okay, we are back and I am back. I'm the host and pharmacist Paul White. This morning, we're talking to Amanda Archer of the Canton City Health Department. So, National Public Health Week focuses on areas that are critical to our future success in creating the healthiest nation. This week is National Public Health Week. What are some of this year's themes, Amanda?
Yeah, so National Public Health Week is it's an opportunity to kind of highlight the great work of public health, and also where do we need to go kind of from here. So kind of currently what's happening and what are some areas that we should be focusing on, and then what's the vision and for the future. So some of the themes this year include healthy neighborhoods, emergency preparedness, reproductive and sexual health. And then the other one that kind of popped out to me, there's a couple, there's 7, right? Because there's 7 days a week, but is the future of public health. And I think it's important to kind of start thinking about, what does public health look like in the future, as we, move through these newer times.
So what makes a neighborhood healthy?
Well, healthy neighborhoods is a theme this year. And ironically, it's also a strategic priority of Canton City Public Health, having a focus on our neighborhoods and our built environment. And we know that where we live, work, and play can have a huge effect on our health. There's a place matters is an ongoing theme that kind of underscores the idea that our health status is greatly affected by more than just behaviors and genetics. So where we spend our time, impacts us greatly. Sometimes some estimates up to 40% of our health status. So, if we're going to live, work, and play in a space, or let's just say live in a neighborhood, we would want that to be a healthy space because it does impact our health. So having safe places to live is important. We want to have less hazards. Like I said, we have a nuisance department that's able to go out and mitigate some of those hazards. And so also, pollution is something that could impact our health. So we want to reduce the amount of pollution that a neighborhood experiences. And then there's other things too that I'm not sure that people consider, but like noise pollution, like that can have an impact on our health. And so those are things that we kind of look at when we're thinking about what a healthy neighborhood might look like. And then, I think a lot of times when people think about public health or health, they think about activities. So, having easy access to be active, having the ability or opportunity, I guess I should say, to be active. So having good sidewalks and a place to ride your bike and take walks and be safe just in general, I think is really important to those healthy neighborhoods. So, we know that when our neighborhoods are healthy, it's a building block to healthier population. So that's why it's also a strategic priority for our department this year, or for the next actually 4 years.
I see the scooters are back.
Yes, yeah, right?
Yeah.
Yeah, those are a hot topic.
Yeah. Okay.
Yeah.
All right. So being part of the community, what can a person do to contribute to promoting a healthy environment?
So I think one of the big things, the first thing I would say is, as a public health department, like, we're here to support the neighborhoods. And so, if there is a property, or if there's a complaint that needs to come in, don't hesitate to give us a call so that we can come out and take a look at it, and see what we can do to kind of to help remediate the situation. And I think it's really important that people know that that's one of the actual programs that we have. Our nuisance program is to actually respond to that stuff. I think it's also important, in our communities, in our neighborhoods, is to get to know each other. I think with some of the dynamics in our neighborhoods, we might not be doing that like we've done in the past. And so I think it's important, to let your neighbors know that you're there, and get to know them, if possible. And really build that social cohesion and that social collateral, because it's important. It's not just important for our neighborhood health, but also individual well-being, to kind of have those connections in your neighborhood. And those are also a way to feel connected in the community. So those are two things that I would suggest.
Okay.
Yeah.
So let's talk about emergency preparedness. We talk about this in the pharmacy, like what to stock in your medicine cabinet for that middle of the night headache, fever, nausea problem. But I have a feeling you have a different angle from the health department side of what people should do to be prepared for events that are unexpected.
Mm-hmm. Well, we just had like the storm of the century that supposedly was supposed to roll through here on Tuesday or something. And fortunately we were spared. But that's a perfect example of, being prepared. So, any type of unexpected events or expected that doesn't happen, you want to have some type of preparedness or planning for that. So, any type of power outage or natural disasters like earthquakes or tornadoes. And we had an earthquake like a week ago or 2 weeks ago.
Yeah.
So yeah, we've kind of hit the gamut here in the last month of potential, natural disasters. I guess we've fared quite well. But the preparedness piece of it is as simple as having a plan and supplies. So for us, like in a home, it can be planning for bad weather, power outages, or a fire, having an escape route for a fire, maybe having flashlights, a power bank to charge your cell phone in case electricity goes out, bottled water, and a first aid kit that's ready. And then I always like to also recommend for people to have a preparedness kit in their car, on an individual level, especially in the wintertime, right? So that could be jumper cables, a blanket, flares, first aid kit, flashlight, just in case something happens where you get stuck somewhere. Kitty litter, they say, in case your tires get stuck, you can throw it under your tires to get out of a sticky or sticky spot. But just kind of taking a second to think ahead about where you might be and what you might need in a short time until someone can kind of get to you to help out. So yeah, and we do that emergency preparedness. That's kind of on the personal, and then the health department, we have an emergency preparedness program. And so we actually create plans and identify our response for different community emergencies. And so we have several of those, everything from a influenza pandemic up to different community events that might happen that public health would need to respond to.
Anything else you want to wrap up with for National Public Health Week information?
I would just say that, Public Health Week is an opportunity to learn about all the aspects of public health. Again, I don't think people realize kind of where we are throughout their daily lives, or, their lives in general. And it's really about public health is really about achieving good, equitable outcomes in our community. And that's because everyone deserves to have access to such, and ultimately the best health for them. And I also would like to say, behind all that work is is a team of dedicated public health workers, especially here in our community. You know, the people that work here, live here, play here, you know, and I think that, you know, even through a global pandemic, people are still coming to work for us, and people stuck through that time. So I think it's really important to acknowledge the people behind the week and the work.
Well, so since 2016, certain demographics in Canton and Stark County have had a significant increase in drug overdoses. Why do you think this has become such a prevalent issue in our area?
Yeah, so it's a, you know, that's a big question, you know, with a big answer. But I think if you look at kind of the history of how we got here, you know, it started with prescription pills. I'm sure the listeners and the community are kind of aware of the history of the opiate epidemic by this time. I think we've done a really good job of sharing that information. You know, from the prescription pills, we ended up having people who were addicted. We didn't really have an infrastructure at the time to support a lot of the treatment needs of people at that time. And so some people who weren't able or who weren't ready to get into treatment, they moved to heroin, a street drug, you know, much cheaper, especially after a lot of the legislative changes kind of locked down access to pills. And then from heroin, it transitioned to fentanyl, cheaper, easier to make and get into our communities. And it hit the community really hard. We obviously still are dealing with it. But in the recent years, what we've noticed is that the fatal overdose rate in our African American community has almost tripled, especially since the beginning of this opiate epidemic. And the reason, there's a couple different camps. We're not really sure about what is going on. We don't know if people who in that community are seeking out the fentanyl more now than they were in the past, or maybe they're using different drugs, but it's mixed with fentanyl and they don't know it, so they're put at a higher risk of overdose. But we're just not sure. We are currently working on some focus groups with people in our community from the African American community to see if we can kind of drill down and see what might be causing it, so that we can try to respond to it. But yeah, right now our overdose rates, and I think the last statistic was that in Ohio, our rates dropped for 2023, but Stark County's increased slightly. And so, you know, looking at that to see what might be driving that is important too. I do think a lot of it might have to do with the way the data is collected and the fact that we have two hospital systems locally. And so we might be picking up some cases from some of the surrounding counties. But it's still a problem. And, you know, we still need to address it and look at how we can intervene.
You know, I know you mentioned that there's some resources out there to help people. Are there many or?
Yes, so we're pretty fortunate in Stark County now. You know, I mean, if you would have asked me 15 years ago, 20 years ago when this started, it would have been a different answer. But we do have access to treatment and support resources. And so we have an opiate hotline. We have a website that is kind of a county-wide website called starkhelpcentral.com, which people are able to just, you know, log in and look, and there's tons of options for treatment and different resources to support families and people who are struggling with addiction. We have a savestark.org website also that provides access to treatment and resources. There's a national 988 number of some crisis. If somebody needs to call, they can dial that anytime and connect with somebody. And then we also have harm reduction programming. We have our SWAP program, which is at the health department on Fridays from 2 to 4, which is a syringe access program. It's comprehensive, and we have access to many other services during that time for people as well. And we have a really robust naloxone distribution program, which basically is a medication that reverses overdoses. And so we encourage everybody, regardless if you are in a network of people who use drugs, if you're willing to respond to an overdose, just like you'd be willing to respond with CPR, we encourage everybody to carry a naloxone kit. And they can get those throughout the entire community.
Okay. Hey, Amanda, it's time for our final break.
Oh
Okay.
boy.
You're listening to Health Matters with the Medicine Center Pharmacy. Okay, welcome back to Health Matters at the Medicine Center Pharmacy. This morning we're talking with Amanda Archer. Pharmacist Brad White and I thank you for joining us. Let's get back to the last segment of the show. So, Amanda, what do you suggest someone do if they suspect a family member or friend is addicted to drugs or alcohol? How do you start that conversation?
Yeah, so obviously I think it's going to be a tough situation. I would just remind someone who is in this situation that if their loved one is struggling with addiction, that they may not be ready to hear the message. I think that we often go into it with a rational brain. We do because maybe or the family member and the person who's struggling with addiction, they're not really, because of the brain disease, they're not really thinking with a rational brain, and so there's a disconnect there. And it's hard to rationalize with somebody who is struggling with addiction. And I would recommend that anyone who is in the situation reach out for support first, and really understand that they're not alone, and that there's a lot of people out there that can help them work through this. And I think also something like this is that boundaries are very important before you even start the conversation, because you're reaching out to the person because you care and you love them and you want the best for them. And sometimes the outcome of that conversation is not what we want or we expect. And it's very hard to work through that. So I think having boundaries and having a support system are really, really important when you're ready to have that conversation with a loved one. And I think you have to take care of yourself.
Hmm.
Yeah.
Interesting.
All right, let's talk about another elephant in the room, if you will, about Canton making news about being one of the more obese cities in the state of Ohio. I think it said that we were ranked 18th, if I recall correctly. What contributes to some ranking or news article like this, and what can we do as a community to help support each other to live a healthier lifestyle?
Sure. Well, I'll just say I didn't expect, 2 months into this role to have this kind of national notoriety, because it wasn't just that we were 18th in the country, but we were number 1 in the state, according to this article. And I want to I actually can't remember how much time we have, but there's a couple of things I want to point out. And the first thing is that the publishing site that put this out, they're a finance company. And so they're not a health and wellness company. And so I think it's really important. They were trying to show the cost of obesity, but they're not a academic research facility. And there's also a disclaimer on the article that basically says it's editorial, and user-generated content is not provided or commissioned, and that opinions expressed here are the authors alone. And so they said their opinions. And so I do know that they took some data and they crunched it, and then they came out with something. But again, I'm going to call it an article, not necessarily a study. And the other part was the methodology and the review probably wouldn't really pass like an academic integrity kind of piece. So with that said, I think it's a nice soundbite to gain attention, but I think it's important to look at what was behind the headline and the article, because there is real data there that we should look at kind of individually and then as a community. So they looked at 19 metrics across 100 different US metro areas, and they reviewed 3 areas: obesity and overweight, health consequences, and then food and fitness. And each metric was graded, and a score of 100 was representing what they considered, in quotes, the fattest. And so I think that, again, the title was to get attention, which is fine. But on the obesity and overweight, Canton ranked 39th out of that 100. And then on the section for the health consequences, we actually ranked 10th, which is pretty poor. I think that is kind of where the meat is here. And that talks a lot about the outcomes that we have with the obesity. So, and then the food and fitness, we ranked 23rd, which also was not obviously we're in the top, 20. So that's almost the top 20. So that's pretty poor. But I think what we want to look at is these outcomes, right? So they looked at like high cholesterol. We have a higher, we ranked 10th for this. The amount of adults who report having diabetes, it's high, right? And so that's an outcome of potentially carrying extra weight. And same thing with heart disease, and then an obesity related death rate. And so these are the things I think that kind of pushed us into that top tier, along with the other things, but these are the ones that public health would want to look at these. When I was reading through this in Stark County, 34% of our population reports being obese. And so that's really high. It's actually not as high as the state, but that's a third. That's 1 in 3 people in our county is reporting that they're obese. So that's a step above, according to the BMI chart, that's a step above being overweight. And so I do think that it's something that we need to take a look at, because that risk factor of carrying extra weight and being in the obese category is going to put you at higher risk of poor health outcomes. And that's going to potentially create, premature death. And so I do think it's something that we need to look at as a public health department, our hospital systems and our community. And I think people, a lot of times they think that maybe they can't do anything. But really it's just maybe one thing a day. Maybe when you go to the store, you park a little bit farther. I think you can get really overwhelmed with this idea of changing your life. And I would just encourage people to kind of think about what is one small thing that I can do today that might impact or have a positive impact on my health.
Okay.
I think those small things can really compound, because if you just start with a walk around the block, then maybe in a month it becomes, 2 laps or 3 laps. And so, you just got to do something little every day. You don't have to go to the gym and be some, big time weightlifter. But, but yeah, I agree. So, all right. Well, I think we're getting a little bit close. Maybe it'd be best to cover again your contact info and how we can reach out to public health and make sure that we can be the best partners we can be in the community.
Absolutely. Well, I want to thank you guys both for the opportunity. It's been great to discuss both the past, current, and hopefully the future work of the health department. We can be reached at 330-489-3231. Also, again, our Facebook is a great place to keep up with us and stay connected. And I just want to thank you guys for having me on, and the community and my colleagues for such a warm reception into this role. I know I have big shoes to fill, but I'm excited for the opportunity and to continue working and serving the community. So thank you.
Thank you.
Okay. I guess we're out of time, right?
Yep.
I wish we could talk to you longer.
Yeah.
Maybe a second trip, huh? Okay.
You got it. Yeah, I appreciate it. Thank you, gentlemen, both.
You're very well versed. I really enjoyed it. I'm sure it got to the people. So good deal.
Thank you.
So thank you to our guest, Amanda Archer of the Canton City Health Department. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Altman Health Systems and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC. Thank you, Amanda, very much.
All right. Thank you,
Thank
guys.
you very much.
Yeah. Have a great Friday.
Yep.
You too.
Talk soon.
Thank you.
Bye.
Bye-bye.
Bye-bye.